Hello, my name is Jenna Petersen. I am an Indiana State University LPN to BSN student. This is my community health education video for Nursing 444 Community Health. Today I will be discussing advanced directives and POST forms. This presentation is geared towards our community. After this presentation, you should be able to identify what a POST is and who it is for, identify what an advanced directive is and who it is for, understand why these forms are important, explain where to obtain these forms, identify who can assist with filling these forms out, and identify resources for further learning. Before we begin, please use the link below to take a quick pre-test. POST. POST stands for Physician Orders for Life-Sustaining Treatment. This often includes orders regarding resuscitation, ventilation, tube feeding, antibiotic use, do or do not transfer to the emergency room, do or do not admit to the hospital, and pain management. The actual forms vary state by state, but they all must be signed by a provider, such as a doctor, nurse practitioner, physician's assistant, or naturopathic doctor, as it is a medical order. POLS are medical orders that can be filled out by those who have progressive illness or are seriously ill. POLS forms are available from your healthcare provider or available to download online. The Oregon version is available at oregonpost.org. POLS are kept at your home and can be used by first responders in case of emergency. Your POLS is also able to follow you wherever you may receive care. This could be the hospital, a nursing home, rehab center, etc. Usually it is displayed prominently, like on the fridge, so they know and can be able to find it easily. Things to consider are that it can be revoked at any time verbally, but new forms must be filled out with your provider and signed. A POST also does not appoint anyone to make medical decisions for you. And you should also review and update your POST as your health condition changes. To review and update a POST, you can void a prior POST, and you should also make sure anyone who has a copy has the most up-to-date form. Here is an example of the Oregon POST form. Section A indicates what should happen if you are found unresponsive, pulseless, and not breathing, whether to attempt resuscitation or not. This is what it means when you are a DNR or a CPR code status. Section B indicates what should happen if you have a pulse and are breathing but need medical intervention. This includes comfort measures only, limited treatment, or full treatment. You can also indicate other orders here, such as tube feeding, etc. Section C documents who was present for the pulse discussion, whether it be your family, you, the patient, an alternate decision maker, or a court-appointed guardian. Section D is for your signature or your surrogate signature. And Section E is the provider signature and the date. The date is important because the most recent one will be used. Advance directives. An advance directive is a legal document in writing to outline your wishes and desires should you not be able to communicate. There are many forms available, but they need to be signed by you. You can involve a lawyer if you desire, though it is not required. Depending on your location, it also requires a notary and/or witnesses. Advance directives should be completed by all adults, regardless of age or health status. Oregon has forms available to download from the Oregon Health Authority, but many similar forms can be found elsewhere. An advance directive is not an order, so it cannot be used in emergency situations, but will be included in decisions should you require hospitalization or rehabilitation. You can also revoke your advance directive at any time without your provider's consent. It does appoint someone to make decisions for you should you not be able to, but it should also be reviewed and updated as things in your life change. You can also decide whether or not to include it in your medical record. The Oregon Advance Directive form was recently updated in 2021. Section 1 is your info. Section 2 is who you declare as your healthcare representative and any alternatives should they be unable. Section 3A includes your healthcare instructions in a variety of circumstances, such as in case of terminal condition, progressive illness, or if you're permanently unconscious. Section 3B outlines what is most important to you and what you value. This can help your representative make tough decisions. Section 3C outlines any spiritual beliefs or needs you have. Section 4 outlines other information about your life, values, where you would or would not like to receive care, and any other info you wish to include. The final section is for your signature, your witnesses, notary, and healthcare representative signatures. Resources can be found online at oregonpulse.org or oregon.gov/OHA Advanced Directive Adoption Committee page. You should also discuss your advanced directive and pulse with your provider, nurse, or social worker should you have questions. It's also important to talk with your family about your wishes. Thank you for listening to this presentation. Now that we are finished, you can take time to use the link below to take a post test. After this slide, there will be a copy of the summary also included in the links below, and a copy of the pre and post test.